I'm Dr. Lulu, and if you're new to joining me and finding out about me, I'm super excited to have you joining us. So, I'm a naturopathic physician, a functional medicine practitioner, author, and botanical formulator. I love herbs. I love herbs as a way to really help the body, to ignite the body, and help heal the body. They're so powerful. I really specialize in helping women, especially, regain hormonal balance, right? Really helping them to reach optimal health and vitality by discovering the root cause of really what's going on in there so we can figure that out together. And I'm also an international speaker and author. Spreading my message about health and educating the world about prevention and well-being. Okay. All right. So let's talk about osteoporosis first, because I think this is a big piece that has to tie in with bone health, right? Osteoporosis and osteopenia. And both of those pieces are important to understand what's happening with the bones and what osteoporosis is. So I'm going to be talking about symptoms and causes and specific risks. So osteoporosis, right, that porosis part of the word really means this porous bone. And it's a state in which the density and quality of the bone is reduced. So if you go, for instance, to get a DEXA scan, that's measuring that bone density on a scale. And osteoporosis affects both women and men. So it's not just for women, even though it's more commonly heard about and discussed in women. And 1 in 2 women over the age of 50 have osteoporosis. So that's huge numbers, right? And so we really want to be preventive in our bone health. And 1 in 5 men. So it's actually a lot of men also have osteoporosis or will experience osteoporotic fractures in their lifetime, like a hip fracture or a wrist fracture or a shoulder fracture or neck fracture, right? So we really having healthy bones is so important. So as we age, those bones become more porous and fragile, right? So they have that density becomes more fragile, like this little fragile piece of glass. And then that risk of fracture increases over time, right? That's what you probably hear about different people getting fractures in different stages of their life. So osteoporosis is pretty serious and widespread. And there's lots of steps that we can take to prevent osteoporosis, but also really to maximize our bone health. So while osteoporosis can really develop at any age, it's a lot more common. We'll see it over the age of 50 because that's when we really have that estrogen change. Like I mentioned, I'll talk more about that. And our bones are more amazing and complicated than a lot of us realize. So 1, they provide a structure, right? Holding that structure in the body. They also contain so many minerals necessary for life, right? Calcium, magnesium, vitamin D, really important. And additionally, within the bone marrow, right inside the bone, our body makes red and white blood cells. So the bones are an integral part of our immune system. So if that bone health is not optimal health or is not optimized, where you can see a lot of the conditions change in immune health, which is why we also see in that elderly or geriatric population a change in immune health when osteoporosis is more common. But we're not just talking about that age group today, but I don't want to talk about first said that osteoporosis stage so I could talk about bone health, but I'm going to be talking about all the different stages because bone health is important from birth to death, right? Through all those stages. So let's talk about some of the symptoms that you might be experiencing or you might have heard of about osteoporosis and when those bones really just in general, when those bones start to change their shape and that, or not their shape, but their bone density. And that can really affect, let's say, for instance, you have a poor digestive system and you have malnourishment, you're not really getting in the things you need. Your bone density is going to change because that calcium, vitamin D, magnesium is not being absorbed into that bone health, right? Into that length of the bone or the long bone, it's particularly, or a particular joint like the shoulder or the hip. So those bones become weakened and they're more susceptible to sudden and unexpected changes like fractures, fall down the stairs, or maybe you bump your elbow or you have a biking accident, something like that, right? You're more prone to having a break or fracture in a bone. And it's called the silent disease because there's really not a typical symptom, right? You don't, unless you have a break or you have a scan or a functional medicine test, you don't always know what's going on inside the body. And that's why it's important to have that preventative health moving forward. So some symptoms, you can feel like a vertebral fracture, which can, if that happened, especially a small fracture, you can have a lot of vertebral like back pain. You can have a loss of height, right? So let's say you started out at 6 feet and you're like, oh, I'm at 5'11". What's going on in there? Or you have, that's a big wish of mine, right? I'm only 5 feet. So I was projecting there. You could have a spine malformation, right? So you could have a hunchback. That's a change, a decrease in the spine. So it's sitting up straight is super important. And the disease of bone density or osteoporosis or osteopenia, this often progresses with symptoms of pain because that change in the actual density of the bone. And that can cause nerve changes, that can cause different pressure on it's like that weight of the bone, right? That bone is taking a lot more pressure than it and weight bearing than it can handle. So we can have lots of different symptoms there. And some of those other symptoms I wanted to mention. So you can have a loss of height, you can have tingling in your hands and feet, you can have headaches, you can have aching joints, you can have pain in the low back. You can have fractures. You can also have shortness of breath because the lung capacity changes because those discs compress. So when we have a change in our bone density, we can see a lot of changes then in the specific areas of the body. It can become systemic. So what are some of the causes of osteoporosis? Now, like in research and evidence-based medicine, they're not really exactly sure where it stems from. But from a functional medicine perspective, I'm totally sure because of the change in estrogen, the change in hormones, the change in the way that we eat, the change in the way that we absorb. So there's a lot of factors that can contribute to a change in bone density, making them more fragile and easily broken. Lots of people can have a change in their bones and they can become weaker with age, but in some people, this can really happen very quickly, right? Depending on their health and their chronic disease state, like an autoimmune disease or a digestive disorder or hormonal disorder, that bone density can happen more rapidly, or a change in bone density can happen more rapidly. So there's really not a cure for osteoporosis, quote unquote, right? Air quotes, cure, but the symptoms of the disease can be managed with medicines, supplements, lifestyle changes, which I'm going to talk about. So that's super important, right? To address from the preventative standpoint ahead of time. And osteoporosis is caused by a combination of factors. So we have genetics, of course, those come into play, and lifestyle choices like alcohol and smoking, those can really affect bone health. And genetics really come into play as a way we absorb calcium and other nutrients, right? So if that digestive system is poor, you're not going to be absorbing the nutrients you need, and you're going to have poor bone health, resulting in pain and fractures. And this can really change how strong the bones are, right? The actual strength. And like I mentioned, smoking cigarettes, that's a huge one. Drinking too much alcohol and caffeine, being underweight or overweight, these can all change that bone density, which can cause osteoporosis and really weakening of those bones. What's really been proven to help is exercises. These can help strengthen the bones, but it isn't really enough on its own. But eating foods, which we're going to talk about, rich in calcium and vitamin D, these can be really helpful. And so osteoporosis, what is the real kind of cause is between bone breakdown and bone formation, right? This imbalance between those two. A bone breakdown, that's osteoblasts, they break down the bone, and osteoclasts, these form bones. So you have this change between the two, an imbalance instead of being normal. And when we have with estrogen changes, we have a change in those osteoblasts, that osteoblast bone breakdown. So we'll have the bone breakdown happening more rapidly. So when your body then breaks down more bone than builds up bone, you lose bone mass, right? It's a simple mathematical equation. And this can really depend on your age, your sex, and your medical history, right? What's going on in your medical background, and really bringing on things to be preventive and proactive around your bone health. So you're really more likely to develop osteoporosis in the future, in the long future, right? Hopefully, if you have risk factors for disease, right? And so that's really important to look at. And what are those risk factors? So lifestyle changes can reduce risk factors. Medications can, there are some pharmaceuticals that are recommended for bone health, but these can have really bad side effects, right? And so it's better to get it from your diet, your food, your nutrition, your other lifestyle components. And the other piece that I want to talk about here is if you're moving into early menopause or perimenopause, and that's before the age of 45. So if you have a hysterectomy where both of those ovaries were removed, this can increase the early development of osteoporosis, or if you have a lot of hormonal problems where you have poor estrogen. And this is because that your body's estrogen production is reduced dramatically, right? And so that speeds up the process of bone loss. So if you're tuning in, you're like, oh yeah, that's me, then you really want to be proactive about your bone health. So another popular cause is the lack of exercise, right? So your body needs movement. It's really important for movement, because when you don't move, you're putting yourself more at a risk of losing calcium from the bones. And so then you have that increase of developing osteoporosis and poor bone health. So if your diet doesn't include enough calcium or vitamin D and you're underweight, you're going to have this increased risk. Okay, so that's some of the causes. And then one other secondary cause of bone loss, and this is for patients who are affected by drug therapy. So that can be drug therapy, endocrine disorders, so specifically thyroid disorders, eating disorders, immobilization, so where they're not able to move at all, a marrow related disorder, so a bone disease that can really change the bone health, of course, and disorders of the gastrointestinal or biliary tract. So that's any of the GI conditions, like especially really extreme ones like celiac and Crohn's disease and renal disease and cancer. So those are huge causes, of course, towards bone health. But hopefully all of you tuning in are not a lot in that category, right? But if you are, then this is really time to be proactive. Okay, how's everybody doing out there? Andrea, how's it going? Is it making this sense to you? I hope people are having a moment and they're able to get in, because I know I had a lot of people signed up tonight. So I hope that the link is working well for people. But if not, you're going to tune in later. So let me know if you have any questions as you're tuning in tonight. And later, of course, if you're watching this later, welcome. And of course, you can always message me with questions afterwards. Okay. So let's talk about some more of the risks. I think it's important to know if you're in that risk category and you need to be more proactive about your bone health. So age factor is hands down number one. So as over the age of 50. So if you're tuning in, you're over the age of 50, or you are in that category where you're in that early menopause or forced menopause, whether you had a hysterectomy, then that puts you at greater risk, number one. Number two is race. Caucasian and Asian women are at higher risk. African American and Latino American or Mexican American women have a lower risk. Caucasian men are at a higher risk than African American and Latino American men. So there's some different categories in race, and that has a lot to do with heritage. Like myself, particularly, I have Irish heritage, where potato famine, really poor nutrients in my genetics, right? And so that can be prone to that particular risk category. Medications. So some medical conditions and medications will increase your risk. And these can include steroids, treatments for breast cancer, and medications for treating seizures. So those three categories specifically can increase the risk of bone health and bone problems in the future. Changes to hormones. So low levels of certain hormones, especially estrogen, like I mentioned, low estrogen in women after menopause or early menopause. Eating habits and sedentary lifestyle. So you're more likely to develop osteoporosis if your body doesn't have enough calcium and vitamin D. That is what you need. Calcium, vitamin D, and magnesium. You got to have, that's like the trio, that triangle, right? for bone health. Without those, your bones are just going to fall apart, literally, right? And an inactive lifestyle, especially when you're not doing weight-bearing exercises, really strengthening the body, doing those push-ups, right? Doing those pull-ups, really things, using weights at home, whatever, or at the gym, doing those things that really are great for the body. And then, like I mentioned, tobacco use and alcohol use, these really affect the bone density and bone health. Smoking and alcohol increase the risk of fracture, right? Alcohol, what it does is it affects the cells that build those osteoblasts and break down bone, the osteoclasts. So it specifically, and with the liver, affects those cells. So it's not good. That maybe that's why a lot of people that are heavy drinkers will have a lot of falling. I don't know. It might be correlated in a different way, but I think in long term, we see more fractures. And if you're a woman, smoking increases your chances of earlier menopause as well. So that's very important. If you are smoking out there, it's really bad for your health, right? Super bad. I hope you don't need me to tell you that, but I'm going to. It's really bad for you. So don't do it and quit and reach out to me if you need help. Okay, let's talk about bones and hormones specifically, because hormones, that's my jam. Of course, I'm going to talk about that. Most of us really don't spend too much time thinking about our bones, right? We're just, because they're in the inside, we don't notice them as much. They're just holding us up and helping us live day to day. So that's why this talk is so important, because it's a big piece of our future, right? We want to be like 100 and be able to race around the track with these really strong bones, right? They help us stand, move, sit. They protect our inner organs, right? If we have poor bone health, we could easily have a injury to an organ. They protect our lungs, our heart, our brain, right? They're our storage site for minerals we need to survive, like calcium. I'm going to say calcium over and over again tonight. Calcium is so important. Calcium. And they house the bone marrow where our blood cells are made. So again, super important for the immune system. And hormones are important to bone health and strength. So remember tonight, hormones, bone health, and strength, right? So they're highly connected or correlated to that. So too much or too little of certain hormones, especially estrogen, in the body can contribute to a change in bone density and lead to osteopenia and osteoporosis. So hormones operate within a web of interconnection impacted by many factors. So with the balance ultimately affecting the function and health of body systems, right? We see this whole interconnection of the web of everything, all the hormones in the body moving, communicating, like this world wide web, like the computer, right? And they're always connecting with the skeletal system, because those hormonal systems, especially like the parathyroid gland, is communicating. Estrogen is communicating. The thyroid gland is communicating. This complex network of all these different hormones coming together, they're going to respond to different things in the blood, calcium and phosphorus levels. That is going to change the communication of those hormones, and then can change the bone health. And that changes the formation, but really it changes the turnover of blood cells or the osteoblasts, the ones that build the bone, and the osteoclasts that break down, changes it more rapidly through the life stages. Okay, so supporting our hormones or our bones from the relationship of the hormonal perspective is really super key, because that will help us to maintain this optimal health, this optimal bone health over time. In addition to aging, like menopause or male hypogonadism, these can really affect also medication specific pharmaceuticals and a range of chronic diseases, like I mentioned. These can contribute to poor bone density, also inflammatory bowel diseases, liver diseases, kidney diseases, celiac disease, diabetes. These all can contribute to that change in bone health. And that's the functional medicine approach, right? Looking at bone health by all the different influential factors like epigenetics, right? Everything around us that influences our bone health, right? Influences that hormone dysfunction, okay? How you doing out there, everybody? Drinking your water? I'm gonna have a little sip. Is this ringing true for you out there? Are you learning about how our bones interact? What's your favorite bone in the body out there? Is it the long bone, the femur? Maybe it's one of your phalanges. What's your favorite bone? Put it in the chat over there. Let's start a little chatting up over there. For me, I don't know. Maybe it's the sacrum. I think the sacrum is probably my favorite. It's just a huge job, right? Holding the pelvis. It helps us to sit. It helps us to move. It helps us to change when we're going to labor, having a baby. So the sacrum is a really important bone in our body, right at the bottom of the lumbar and in the spine. Super. So that's my favorite of now, the sacrum. Okay, so long-term implications of osteoporosis. I've mentioned a little bit, but so increased risk of fractures. So again, and when I say the term osteoporosis, I just want you to think about like poor bone health. It's synonymous. It's a synonym. So an increased risk for fractures is huge. Immobility, right? And so these fractures can cause long-term immobility over time, a lot of whiplash or different fractures throughout the vertebrae, spinal injury. Maintaining a healthy lifestyle, right, with a diet, nutrition, and exercise, minimizing alcohol and smoking is really going to change that risk factor and keeping the hormones in check, in play. Super important. So now I want to talk about specific hormones in the body that might be new to you, but some of them you might have heard of. These are going to be very specific to our bone health. So leptin, Leptin, leptin. So I'm going to put that over in the chat over here, leptin. Okay. So leptin, this is a hormone that has direct and indirect influence on bone metabolism. So this is basically our bone metabolism hormone. Vitamin D. So vitamin D is a hormone, and this hormone helps the body absorb calcium. You have to have good levels of vitamin D to absorb calcium, and that's why it's so important to have those vitamin D levels checked. If that lowers, right, and especially for a long period of time, those levels of calcium can fall and fail. This causes the parathyroid hormone, PTH, to be released because the parathyroid gland controls calcium production or calcium release, and this causes the bones to have early breakdown and release their calcium. So vitamin D is so important. I recommend out there testing it at least every 6 months if you already have a history of vitamin D deficiency. Okay, insulin, you probably heard of that one. Insulin is important for bone growth. So insulin signals and regulates bone formation and bone resorption. So insulin is very important. Glucocorticoids. This is one of the things that's released from the adrenal glands. These hormones act on the osteoblasts, those ones that build bone, and they reduce bone formation, as well as causing a period of increased bone breakdown. Okay, so glucocorticoids, that's like a steroid, right? In that same kind of category. The effect of these hormones is seen when you take a high dose of a glucocorticoid medication, right? Such as prednisone for a prolonged period of time. That's where they will measure that bone density when you're on steroids for a long period of time. The next one is estrogen. Like I've mentioned, the major effect of a loss of estrogen is an increase in bone resorption, okay, which this leaves a gap in the bone formation and resorption, okay? So we want this even level of estrogen to be released. So if you have a major change, you're going to have a rapid decrease in the amount of bone density. A rapid fall can occur at 5 to 10 years following menopause. So it's really important to keep those in check, to do specific bone density checks and be taking particular supplements. Vitamin D, calcium, magnesium, that trio, very important. So this balance between bone formation and bone breakdown is important, right? We want to maintain bone mass and bone density. And if that balance is like off skew, right, for in the scale and one of us like this, right, then we're going to have problems of the strength of our bones. That bone density, that bone strength is going to change. So here's a great example. So too much breakdown of bone without that corresponding new bone then leads to bone loss. leads to bone breakdown, leads to osteoporosis, and that leads to easily breakage of bone. So if you're prone to a lot of bone breaks, you want to really look into that, right? What's going on? Check in with me, or you're a natural health practitioner. So I wanted to talk about, there's a lot of specific medications that if you're taking pharmaceuticals that can cause bone loss. So if you're on these medications, and I'm going to share the slide because that way I don't have to read them out loud to you, and that way you can see them. Let me do that. Okay. Let me know in the chat if that's not sharing. Okay, so all of these specific medications can change bone density, right? So these are, and you'll get these are all in the guide. So it's very specific if you are taking these to have your bone density checked, as well as to bring on specific supplements, food, nutrition to really help you. So let's just go through a few of these. Aluminum containing antacids, methotrexate. That's a huge one. Selective serotonin reuptake inhibitors, or SSRIs, right? Antidepressants, Zoloft, Prozac, anti-seizure medications, cancer chemo drugs, thyroid hormones in excess. So if you're on the wrong thyroid medication like levothyroxine or Synthroid, glucocorticoids, steroids, inhaled steroids like asthma medications. So those are really ones that you want to look out for. If you're taking those, go through that list, or if you're taking a medication, go through the list and make sure it's not on there. And if it is, check in with me or your health practitioner. You really want to make sure that you're being supported with that. That is really key. And osteoporosis is not osteoporosis is not a normal part of aging, right? It can be, but let's be preventing it. It's caused by many factors, which you've heard me talk about, caused by many factors. So it can be caused by heavy metal toxicity, which is why it's so important. I always recommend doing a heavy metal test. It's a pretty inexpensive one. It's really great to check your heavy metals. These could be really changing your bone density. Rheumatoid arthritis, many autoimmune disease medications, hormone imbalance, and lack of physical activity. These are all going to contribute, again, to osteoporosis. So check your medications. That's my main thing here. I really want you to focus on checking those. And let's see. Andrea has a question coming in. Let's see that. I take levothyroxine. Is that one that will cause issues as for my thyroid? So yes, it can cause issues. And especially if it's in excess, like if it's not being monitored, so you just want to make sure you're monitoring when you're taking a thyroid medication, it's being monitored at least every year. If you're having a lot of swings in energy and changes, then you might want to have it monitored more often than that, like every 6 months, because you don't want to be taking an amount that is not in alignment with you, because it can change the way your thyroid and your parathyroid work, right? Their efficiency, and that can lead to changes in bone density. So that's a great question, Andrea. Yeah, so levothyroxine and Synthroid, those are two that you want to have checked. Or those are two you want to know about and to make sure you're being checked. And if you're in that, excuse me, if you're in that category where you're having changes in specific bone density, if there's all those symptoms that I mentioned, right? If you're like, oh, I'm having a lot of those and happen more frequently, maybe you want to have your thyroid checked more frequently and monitor that levothyroxine dosage. Okay. I'm right. So all medications, all pharmaceuticals come with a risk for side effects. If you don't know that by now, let me make sure you know that. So you go online and you look in the side effects of a drug and you look at the side effects, there's always some, right? It's always some huge list. And they can include nausea, drowsiness, dry mouth, rashes, diarrhea, serious complications, liver damage, heart attacks, strokes, right? So many side effects, but too many people are unaware of them, including physicians, right? They're not aware of the damaging effects. They just prescribe, they don't look at the side effects. on the bone, right? So really important. If you're taking one of those medications, you want to check with your provider. Say, hey, I'm taking this specific, like Andrea mentioned her Levo. You want to make sure that you're checking with your provider and say, hey, I know that there can be, I want to have my bone density, my bone health at the forefront of our thinking because I'm on this specific medication. What are your thoughts? And so Andrea mentioned she has her blood drawn every 6 months and it's stable. That's great. Okay. So yeah, you're monitoring it, but you also just want to bring up that piece or with the provider or with the natural health practitioner like myself about your bone health. Okay. So you want to follow a diet filled with great calcium and vitamin D if you're in any of those categories. And you can seek a registered dietitian out, or you can connect with me about specific foods you want to take as calcium supplement if needed. And again, talk to your health provider about that. And calcium can come in a lot of different forms. It's best to get it from food. Okay, let's talk about lifestyle-based approaches to healing osteoporosis. My favorite. I love talking about lifestyle, but I like to give the behind the scenes. Okay. So lifestyle changes play a huge role in osteoporosis and really for bone health, right? And we know that when we make lifestyle changes, it's like a domino effect, right, on our whole particular aspect of our life. So when we make lifestyle changes specifically for low bone mass to prevent that condition from progressing, we really want to focus on staying as healthy as possible. And we want to promote bone health from age, like I said, from birth to death. Okay. And so there's going to be lots of things I'm going to talk about here as ways to manage bone health and as well as what particular lifestyle things we want to bring on to really help with bone density. So some of the things are diet, really important to focus on food, enough exercise, again, that bone density exercise, and kicking bad lifestyle habits. These are really going to help make a difference. So let's talk about exercises. So I'm going to talk about 4 different categories here. Exercises. So weight-bearing exercises. These are super important, especially if you already you're prone to having those risks, you're in the risk category and you've already had some of those symptoms come up. Always check with if you have a physical trainer or someone that can help you with exercises, that's great to bring them on. Or if you're knowledgeable, make sure you're doing weight-bearing exercises. These are going to force your body to work against gravity, right? And some examples are walking, jogging. You don't have to use weights, right? Racket sports, Tai Chi, and yoga. These are great ones. You could alternate with those every day, doing a different exercise, or kind of alternate twice a day, doing something in the morning, something in the evening. And yoga and Tai Chi are not only great for relieving stress, super good. I love yoga. Do you guys know I was a yoga teacher? That's a good little fact for you. And enhancing a calm state of mind, right? So reducing stress is, again, that domino effect affects every piece of our body. And it's an excellent way to improve balance. That's when you probably have heard and know about that a lot of people have balance issues as they age is because those bones are not strong. They're not doing those weight bearing exercises. So you want to start doing them now, right? You want to do them now, don't wait. And they also strengthen your core muscles, right? That abdomen, and engage them in a way that stabilizes, right? You want to stabilize that core because that's going to protect the back, right? Really protect the back. It's going to protect all of those pelvic muscles, really help your core to be strong. Okay. Number 2 is calcium and vitamin D. So you want to excuse me. You want to ensure you have enough calcium and vitamin D in your diet. So most adults need 1,300 milligrams. Okay, I'm going to put that over here. 1,300 milligrams of calcium per day. How are you getting enough out there, right? Per day, right? Are you getting that? Wow, that's a lot. Or maybe you're getting it with food, but if you're not getting it from food, how you're getting it, right? You might need to get it from a supplement if you're not eating well, if you're not getting the nutrients you need. Your body also needs vitamin D to absorb calcium. And like technically they say like 800 IUs, but that's way not enough. I would say like 2,000 per day is usually much better. And that's different depending on the person, right? Always measure that and check with your provider. But usually like 1 to 2 is a much better range. limit your cola drink. So there's lots of studies that have been shown that cola, so soda pop, soft drinks, are associated with bone loss. While more research can help us understand the link, this is what we know. The carbonation in the soft drinks does not cause any harm to the bone. It's the caffeine and phosphorus that are found in the cola that contributes to the bone loss. So I'm talking about specifically of cola, like Coca-Cola, okay, particularly, and so other soft drinks that will have caffeine and phosphorus, right? So that can contribute to bone loss. So if you're a soda drinker out there, a cola drinker, switch it up. Do something like carbonated water with lemon or lime, something like that. And I already mentioned smoking and alcohol. You got to stop that. Not good for bone health. If you can limit your alcohol to 1 to 2 drinks a day, if you are drinking, that will really help your bone health. And that also really affects your estrogen levels. Reducing alcohol, taking a break, really looking at how much you're drinking, all those pieces are really important. Limiting your salt intake. Andrea said, so hard to break the soda cycle. I've tried and failed so many times. Yeah, your body's addicted. It's easy. We're all addicted to so many things. Yeah, I know. I get you. I hear you. The best thing I can recommend is to bring on something else, right? Besides the cola so I like to drink kombucha with its carbonated aspect, really good for the gut. I also like to drink carbonated water, and I'll put in like a drop of essential oils in a large container, like peppermint, lemon, grapefruit, orange, or I'll make an infused water, especially this time of year. Make a big pitcher of lemon infused water or lime infused water, cucumber infused water, right? Making some waters that are really healthy. And then you just have to be strict for yourself. Like, what's the result? Especially if you're looking for bone health, you're like, okay, I know every time I drink this cola, it's going to do X, Y, Z. Okay. Some people are good with a reward system. Maybe make a reward system. If I don't drink a cola for a week, can buy a new book. I don't know. Some people like a reward system. So maybe that will help, Andrea. Okay, salt. So sodium, which is the primary ingredient in salt, increases urinary calcium loss. So if you're have a heavy salt intake, this can actually significantly decrease your daily calcium requirement by reducing your overall sodium, or by reducing your, sorry, let me say that again. You can actually significantly decrease your daily calcium requirement by reducing your overall sodium intake. Okay, so if you eat a lot of salt, if reducing that can change the need for the amount of calcium that you need. And you can also do a calcium test. You can do that through a hair analysis, heavy metal toxicity analysis. You can also do a blood test for that. So that might be good if you feel like your calcium levels are really low, bone density, you can get that measured. And protein helps in the formation and repair of tissue. We need protein. It's an essential part of our daily diet. So we need to have things like animal products. If you're vegetarian, you can do quinoa, legumes, beans, cottage cheese, nuts. There's all kinds of things that you don't have to be eating animal protein, but that's a big part of it, having protein every day. 50 to 65 grams, depending on what your body type is. And I can do that calculation if you need to for me. Just check in with me. Okay. In addition to getting plenty of calcium and vitamin D, try to eat a healthy, well-balanced diet. Nutrition is key. So this is going to strengthen your body overall, right? And you want to, with that nutrition piece, you maintain that exercise routine. So those are the two components that are really strong: nutrition and exercise. And recent studies have shown that olive oil, soybeans, and blueberries, are any food that is rich in omega-3s. These, like flaxseed oil, this is going to really help for bone boosting, right? Super important. And I love all those. Omegas are so good for inflammation, really important. And so while additional research is needed for that link between those foods, we already know how beneficial those particular foods are and adding them into your diet. So that pulling in those blueberries, pulling in those really great oils like olive oil and avocado oil and coconut oil to nourish the bones. Increasing your fruit and vegetable intake. These are going to help increase that aspect of vitamin D and K, potassium, magnesium, folic acid, right? You want to look at those particular foods and bring those in, right? So again, calcium, potassium, magnesium, vitamin K, folic acid, those are all going to be in our leafy greens. Really important to eat a great salad with your kale, your spinach, your chard, etc. Okay, let's talk about the functional medicine approach and long-term approach to bone health. Okay, so this is an important part. So many millions of Americans are told each year that they should take bone drugs. Those are the ones I mentioned. Those are the ones that can cause bone density problems, but also there's specific bone medications that are prescribed for bone density problems. And these adherence to these drugs is really low because the side effects are really bad. Rashes, esophagus, stomach ulcers, jawbone decay is a huge one. So we need to have another piece. And those drugs, by the way, are called bisphosphonates. Okay, so a physician will recommend a bisphosphonate or hormone replacement therapy or estrogen receptor modulator. These can all affect our bone density, right? So it's important that we know those as we're moving into that prevention piece. And so in conventional medicine, doctors diagnose the disease, right? And then they match it to a specific treatment. You have this, you're going to get that. And that doesn't always work, right? Because they're not addressing the root cause. I feel like it usually doesn't work. But when someone is diagnosed like with an acute problem, that approach can work, like a heart attack, right? That acute piece can really work. But for many chronic conditions, we need to look deeper. Osteoporosis, high blood pressure, digestive issues, neurological problems. This is when we really need to dive into the functional medicine approach and look at the root cause, right? What's going on in there? So functional medicine addresses the root cause of disease rather than an isolated set of symptoms. It's the same purpose or function of naturopathic medicine. So we want to address nutrition, sleep, exercise, stress levels, relationships, genetics, right? We want to look at all components from the perspective out of our bone health. All those are major contributors, right? They're really going to help us understand what's going on with our system. So we often consider good health as not having something wrong with us, right? But the absence of disease is not the only signal that we're in good health. Okay. Vitality is important. Good appetite, optimum weight, a settled emotional state. These are indicators of general wellness. So if all those are off or one of those, then your body is sending you the sign that something's not right. Something's going on. So the functional medicine and naturopathic approach put them at the center of healthcare, right? Not in the back burner. So we want to look at specific things when it comes to food, okay? And so we want to follow a diet for bone health rich in the following foods: calcium. I'll say the nutrients and then I'll talk about foods: calcium, vitamin K, magnesium, potassium, and vitamin D. Those 5 are the key players in our long-term management of bone health. So calcium, of course, we get that from dairy. Most people know that, but a lot of people are sensitive to dairy. So we want to look at other ways. Broccoli is rich in calcium, greens. Orange juice is a great one. Some cereals are fortified with calcium, but those are not good for us, right? Fortified cereals, processed grains. We want to get it from a whole food, whole grains. Vitamin K, so vitamin D and K2 really work well together. Vitamin K is going to be your leafy greens and cauliflower. Okay, those are good. Magnesium. And all these are in your guide too. So don't worry if you're like, what did Dr. Lulu say? So you can also rewatch the video too, or tune in now and you're writing them down. So magnesium foods, avocado. Oh my God. Who doesn't love avocado in there? Maybe not everybody does, but raise your hand if you're an avocado lover. Oh my God. I love avocado. I would say hands up. That's me. Woohoo. I could definitely eat one a day. I don't know about you guys out there, but love it. It's so soft, good for the systems, rich in nutrients, fatty acids. It's got magnesium, helps us relax. Bananas have magnesium and potassium. Cantaloupe, honeydew, oh, so good. Melon season. Yay. Andrea loves avocados. I knew it. Love it. Lima beans, low fat milk. Okay. Nectarines, Orange juice again, potatoes, and spinach. So there's lots of foods. And if you need any of these specifics, I have lots of handouts. You just check in with me like, hey, can I have the magnesium handout? Of course, I'll send it off to you. Just let me know. And you can always email me or check in with me if you're already a patient in the portal. Potassium, whole grains, nuts, spinach, oatmeal, potato, peanut butter. I'm not a big, some of these I'm not a fan of. I'm just going through, like, peanut butter is really inflammatory, but I'm telling you, it does have potassium in it. Vitamin D. So the body makes vitamin D after exposure to sunlight. So it is also found in fatty fish, fortified cereals, and milks, and so that's, we can get it through some food, but we get it after we're exposed to light. So if we're working inside, we're not getting light exposure, it changes our vitamin D absorption. So preventative approaches, we want to make sure that we are looking at the 5 categories: nutrition, dietary supplements, lifestyle, so physical activity, fall prevention and safety if you're in that category, falling at work, falling at home, making sure you're making good surfaces, wearing good shoes, medications for bone density, and then other therapies like sun exposure, mind-body approaches, yoga. I mentioned that's kind of like the summary, right, of all those things we talked about earlier. So supplements, what supplements are good? Oh my God, there's so many great ones. And I'm talking about those and some herbs. So supplements, calcium, magnesium, potassium, right? Those are all the things I mentioned that you can get from food, but we can, and vitamin D and K, and vitamin C. I didn't mention that one, but that's another great one. So those, we can get those from food, but sometimes we're not absorbing what we need and we need a little extra, right? And taking them in a supplemental form. And it's much better, of course, to eat those foods, right? Because your diet, your body is going to utilize those foods in a different way to supplement. Herbs, horsetail. I love horsetail. So this herb has silica. I love this. It's such a beautiful plant. Horsetail. It's like these fronds, and it's made by the water. I love it. It grows here in North Carolina. It's so pretty. And it will help with the bone density and the strength. So silica is like that backbone, really strong. Oat straw. This is another great one. So this one is from the hormonal perspective. It's going to boost hormone levels that stimulate cell growth. So really help with that bone cell growth, bone building. And thyme. So this is a great herb that we can use with sage and rosemary. And these are going to help with bone mineral density, helping us absorb minerals. So these are great, like culinary herbs you can sprinkle in, make with your food, or put them in a tea or an essential oil. Kelp. So seaweeds, kelp is a great one. This one's particularly for musculoskeletal disorders because it's really high in minerals, great for the thyroid and osteoporosis. So phytoestrogens, these are naturally occurring chemical compounds found in plants. So these are going to be specific foods like red clover. Okay, that's a great one that is a phytoestrogen. And these herbs can be brought in to help mimic estrogen. Okay. Acupuncture herbs relieve osteoporosis, really great for mineral bone density. And like I mentioned, Tai Chi, really helping to get the body moving and help the body flowing, help with bone density. Okay, super. So the last thing I'm going to talk about tonight is conventional treatment versus natural treatment, because I think that's important. Okay. So from the conventional, and you might have heard me talk about it already tonight. So osteoporosis is usually diagnosed later in life. So we want to be preventive moving forward. We want to really, from the medical perspective, we want to know that osteoporosis is low bone mass, right? And that's going to increase our risk for bone fracture and trauma. And so from the conventional standpoint, it's all going to be about surgery, repair, how to heal the fractures, long-term recovery, and all those are really expensive, right? So it's not adding up to good, not looking so good. So when we're looking at drug therapies, like I've mentioned these already, bisphosphonates, really horrible drug. That's when a patient asks me about going on a bisphosphonate, it's my last, and say, I'll do everything else before you go on the bisphosphonate. They're not good. And so also hormonal treatment. So again, I'm just like reiterating, those conventional treatments and drugs are not good. So natural interventions are really going to shine when it comes to bone health. So I'm going to mention these again so that they're in your brain, like putting them in there, right? So calcium, magnesium, vitamin D, that trio, that calcium, magnesium, vitamin D trio. Boron and strontium, these you'll see in a lot of bone health formulas, and you can test those in some bone health tests. Vitamin K, super important, right? And vitamin D and vitamin K work together. Vitamin K's are clotting, but it also helps with vitamin D. And remember, we have all those blood cells in our bone marrow, so that vitamin K also helps with that. And again, lifestyle components, doing the exercises, bone density exercises, walking, stretching, yoga, tai chi, doing light weights, and working with a trainer if you need to get that routine into play. So there's lots of things we can do, having a bone specific plan moving forward. Okay, yay, great. That was a lot of information, right? How you doing out there? How you feeling about all that? That's some awesome information. I love talking about bone health. It's so important. And I want to talk to you about a few more things. So, how to follow me. Of course, if you're not following me, make sure you are, right? So you can follow me, learn more about me, what I'm doing. Dr. LuLu Shimek at doclulu.com. That's a great one. Also, you can check out my podcast, The Genetic Genius. And then I wanted to share with you, there's two. Let me share. It's also in the PDF guide that I sent out. Oh, look at that. So good. In this guide, that's only one page. That's not good. Hold on, let me pull it up. You want to have more than one page in your guide. Let me make sure. I'm going to re-put that into here too, just in case I only uploaded the one pager before. I'll just put it again. Because that would be really silly. Well, I mean, you at least you have the first page, but you need the whole thing. Okay. So in this great guide I sent you, everything I talked about today, you'll see all these pieces here. You can go back and review all the wonderful aspects that I discussed. Understanding the specifics. So review the symptoms right here. If you're having these things, that's a good sign already that your bone health is compromised. And then I also talked about the impact of medications. That's in here for you as well as all those medications. So review those lists. So that way, you know, if you're taking one of these, to check in with your healthcare practitioner about bone health. Here are the great things you want to do to really impact your bone health. Bring on these lifestyle pieces, really important. And the vitamins and nutrients I mentioned, they're just so important. Vitamin D, calcium, magnesium, vitamin K, right? You have a little song about those. Here's all of the great supplements and herbs, different natural treatments, and then the bisphosphonates that I talked to. And then for those of you attending tonight, initial consult, you get 15% off the initial consult. Woohoo! Use Bone Health 15, and I'll send out that link for everyone. If you know someone that needs some help with their bone health, have them make an appointment or you make an appointment. Also, I put together an amazing bone health care package. So it's good. It includes an initial consultation and a follow-up consultation. Plus, I put in a lab package, which is awesome, to really see what your bone health is. So this is discounted for $1,200. And this package is really going to empower you with knowledge, insights, and personalized strategies to optimize your bone health. So you got the link there, and I will also send out, of course, this recap. You're getting it now if you're watching the replay. I'll send out the recap. I'll send out the guide. And if you have any questions or you're tuning in and watching this later, please reach out to me. The bone health is so important. Bone health is number one. We only have one body, right? With the bones inside that we need to have the strength to live each day to the max. All right, Andrea, do you have any last minute questions? You got me. You're like, woohoo, super lucky tonight. It's one-on-one. No, what happened to the other 30 people that were signed up? I hope the link was working right, but you said you got in. Andrea, any questions? Okay. If any other questions come up, let me know. And I thank everyone for attending tonight. It's been a great honor and pleasure to be here with you and talk about bone health and to really hone in how important it is, right? How key it is when we're talking about our bone health for prevention, especially women tuning in tonight. You really want to focus on how can you have the best bone health moving forward? Food, nutrition, diet, exercise, sleep, right? All those components. Okay. How can I get protein if you're lactose intolerant? Are you talking about protein or you're talking, because you can get protein from animal products. Talking about protein or were you talking about something else? Let me know. Maybe you're talking about vitamin D. Protein, so you can get protein from lots of different sources. Vitamin D. Yes, no worries. That's what I was thinking about. So vitamin D, I will send you a great handout with sources for that. But vitamin D, you can get it, of course, from dairy, right? But it also comes from the omegas. Fatty fish is a really good one for vitamin D. But sun exposure, that's really because we get it from the sun. So spending at least 15 to 20 minutes in the sun. And then in the wintertime, if you live in a cold place or a dark place, you need to take a supplement to help you because you're not getting the sun. So yes, that's the main way. Fatty fish, there are some foods, dairy, if you could do something where you didn't have the lactose, but a supplement might be the best way for you. But I'll send you a handout as well. And remind me if I don't. So still having a low vitamin D levels. So you could be having a poor absorption with vitamin D. So out there, the question was, I'm taking a vitamin D supplement, but my levels are still low. So it can be a couple reasons. One, you could have a genetic aspect when it comes to the way your body processes and absorbs vitamin D. Two, it could be the type of vitamin D and the quality. You want to make sure that you're taking it with fat so your body can absorb it because it's a fat soluble vitamin. That's important. And then also it could be the digestive system and you're not absorbing it. So those are some great pieces of it. Vitamin D, we need vitamin D. It's so important. So if you're tuning in and you're like, okay, I'm just like Andrea who said here, I'm eating it, I'm not absorbing it, my levels are still really low, check in with me about what's going on so we can figure it out. Maybe we need to increase that vitamin D to get those levels. I like to see those levels around 50 to 100 in the normal range in the medical field, 0 to 30. Above 30 is normal, but 30 is too low. I especially with my patients, most of you that know me, that's too low. I like to see it 50 and above. So that will really help you feel better, help your bone density, and of course, measuring those every 6 months, at least for your vitamin D levels, if you know that you're prone to being deficient. Okay, super. Well, that wraps it up for tonight. Thanks, everyone. I hope you had a great time tuning in and watching the replay for those of you that couldn't make it. And I'll send out the recap. If not tomorrow, I'll send it out the next day. Okay, thanks again, everyone. Have a great night.